Welcome to SMA's Southern Medicine podcast. Practicing medicine in the southeastern United States presents unique challenges for healthcare professionals. The South's heavily rural population and limited resources require medical professionals to be more resourceful in their approach to providing quality care. SMA's Southern Medicine podcast addresses these issues by drawing on the experience of healthcare leaders who provide a multi-specialty, interdisciplinary team approach to medicine for the purpose of providing better care for the Southern patient population. In this podcast, Southern Medical Journal Editor-in-Chief Dr. Stephen Baldwin will moderate a discussion on implementation of a vertically integrated training program, progress and lessons learned, an article published in the December 2020 issue of the SMJ. We are joined by authors of the article, Ryan Alexander, Simone Werter, and Dr. Donald DiPette. Everyone, thank you for joining us, and I will now turn the conversation over to Dr. Baldwin.
Welcome to this podcast. I would like to begin by trying to have everybody provide some input on what the vertically integrated trainee program is and the motivation for this program. Let's start with Ryan, and then we'll go to Simone and then Dr. DiPette.
Yes, so the vertically integrated trainee program, this was something that was started actually my first year of medical school. It was started by an individual named Jaron Pettis. He is now a general surgery resident in New Orleans. And he told me when I came to USC about a program that he was starting with Dr. DiPette that was looking to bridge USC School of Medicine medical students with Alpha Epsilon Delta pre-health students at USC, along with residents at our local Prisma Midlands. And that was the general gist of the organization.
I first had the opportunity to participate in VITP when I joined USC's chapter of Alpha Epsilon Delta in the spring of my freshman year at USC. The first event that I went to was a social where we were just interacting with the medical students and trying to gain opportunities for mentorship. So this program, while it was created before I officially started working with it, has really bridged the gap between the trainee levels and has provided incredible opportunities for pre-health students such as myself and other members of AED to really gain some insight that we otherwise wouldn't have of what it's actually like being a medical student and all of the things necessary that to become a successful medical student and then a successful physician in the future.
Steve, this is Don. Yes, I've had the pleasure of facilitating, or at least being the advisor, bridging the gap between the USC School of Medicine students and Alpha Epsilon Delta, as Simone just mentioned, for many, many years. And the students on both ends came to me about 4 or 5 years ago with a concept that mentorship is extremely important to them and to all of us. And as mature physicians and physicians already in practice, we always think about mentoring fellow physicians. And I think the large gap has been really focusing on mentoring our junior to-be physicians, if you will, our trainees. And that was the impetus of the VITP program. And again, I think it's also important to note that while I'm participating, this is a trainee-led program. And it is a program to connect the 3 trainee levels. The undergraduate students, if you will, represented by Simone and her colleagues, the medical students represented by Ryan and his colleagues, as well as our house staff, trainees of all various disciplines. And that was the challenge, and that was the goal.
Thank you for those comments. They're very informative. From a trainee perspective, perhaps Ryan and Simone may have a few additional thoughts as to what gap or needs the VITP program is able to fulfill.
Yes, sir. So I would say the events that we have started to build are trying to meet the different gaps and needs. So my belief is that undergraduate universities, they have a structure for pre-health advising. They can tell you what courses to take, how to prepare for the MCAT, but this is a mentorship and an advising organization. And so the social events are to first kind of build interaction, build relationships, show the pre-health students that medical students are just students like them, and that we can be friends, we can be people that they can connect with. And then the other events are to fulfill the advising roles. So the AMCAS workshop to go over the application, mock interviews to help them prepare for their interviews for medical and professional school, and the clinical skills workshop to garner interest in hands-on clinical abilities. So I think the events are trying to reach different audiences and fill those needs.
I completely agree with everything that Ryan just said. We discussed a lot while we were planning VITP events about the need to kind of bring medical students almost down to the same level as undergraduate students, because I know that when I was a freshman at USC, my little pre-health student just starting out, I would look at these medical students like, wow, they really did it, almost as a celebrity of some sort. And I really needed it brought back down to me to know that they are people, they are here to help me. Just because they did it doesn't mean that I or somebody else can't. And I've gotten a lot of feedback from AED members as well, who maybe don't have access to people who have worked in healthcare before. I know I'm very fortunate that my father's a physician, so I kind of grew up surrounded by healthcare. But I know a lot of people are interested in healthcare and don't have that type of mentorship in their lives. So all of the medical students through VITP have been able to kind of fill that gap. And we're able to facilitate relationships with AED members and give them so much confidence. And I know when we had mock interviews this past semester, one of the interviewers was actually a former AED member who is now a M1 at USC School of Medicine. And he told me that he really wanted to participate in VITP again because he wanted to pay it forward for all that it had done for him. So it really fulfills that gap between students who have questions and need guidance, and maybe they aren't getting that guidance from an advisor, because anybody can tell you that medical school or any type of professional school is going to be hard, but they're not necessarily in the thick of things. So it's really helpful to get kind of that firsthand perspective from people like Ryan.
Simone, can you talk a little bit about Alpha, Epsilon, Delta, and also perhaps discuss how it is useful for persons that are not only pre-medical oriented, but also other health professions roles oriented?
Of course. So Alpha Epsilon Delta is a pre-health honor society at USC. We're actually the second oldest chapter, I believe, in the country. I know we are the first chapter outside of the state of Alabama. So our chapter does have a little bit of history to it. We cater to pre-PA, pre-dental, pre-med, pre-speech pathology, pre-occupational therapy, and pre-physical therapy. So we kind of run the whole gambit of who could be a member of your healthcare team. I think the best thing about Alpha Epsilon Delta is that you are able to see so many different healthcare perspectives. And then an even greater benefit, just because a lot of our members are pre med, we are predominantly pre med. That's just how the numbers seem to work out whenever we do recruitment. Is VITP is an opportunity that they're not going to get anywhere but with AED. And actually, because of VITP's influence, we've been able to start another pre-PA mentorship program with USC Columbia's PA program. So all of our members are always so excited about VITP. We help VITP leadership at the medical school plan events on a semesterly basis. We get together and we try to figure out what would be most beneficial for which audiences of AED. I know Ryan brought up our clinical skills workshop. With that, we have opened it up to all pre-health tracks in the past so that everybody can kind of get a taste of what their future career is going to be like.
Thank you for reviewing that information for us. Ryan, you're perhaps in a little further down the track position here, you've successfully been through medical school and now you're going through the residency search process as well. Any information that you can provide as to how you continued your mentoring initiatives through medical school and how you may have learned from that experience and maybe some contrast with the residency placement process as well might be of interest.
Yes, sir. I am eternally grateful for Dr. DiPette and the opportunity to help grow this VITP program. To answer the last component, I cannot tell you how many interviews I've been on that people have asked me about this program, and I've gotten to share what we've did and how we were able to grow it. And anytime anyone asks me what's the most significant part or what do you really take away from med school, it's this program. It's mentorship, it's helping students get to the point that I did because I am someone that's grateful for the mentors that I've had, and I want to continue to shed that light for individuals going into the future. USC helped found VITP, and the med school kind of serves as the primary organizer. But I've seen since I've been there that it's become more and more of a partnership with AED. That these meetings, they're contributing significantly. They're adding new ideas. They're in it with the pre-health students, so they can kind of argue for what they may need. Part of the passion I have behind this program is that I saw some deficiencies when I was at Furman in terms of the medical school advising process, not with what courses you need, how to do well on the MCAT, but the emotional and social support of going through this entire process. I was someone that didn't get into med school the first time I applied, was waitlisted at several schools, and that process of not getting interview invites, getting denied, wondering if I need to take the MCAT again, and all of that while you're having your friends and colleagues maybe have better success. It's it's hard not to take that personally, even though medical school admissions is really a numbers game. So I think that this program and the mentorship component in a medical career is so important for emotional support to keep students knowing you can see the forest from the trees. Don't worry about that 92 on the chemistry exam. If you want to be a physician and you want to attend medical school, we can help you get there. That's kind of where I see the most gap in the role I want to fill with not only this organization but medical school advising in general. And to any student that is considering med school or considering a future, this program has not only been beneficial for me from a CV and an interview perspective, but from a whole heart perspective. I love this organization and I want to continue to see it grow.
Thank you. That was very useful information, I think. The article that you wrote in subsequently was published in Southern Medical Journal details the 3-year progress of the VITP program. What are some of the key points of progress and success of the program that you would cite? And we'll start with Ryan and go to Simone and Dr. DiPette as well.
I would say one of the strongest points is we've really focused on building that partnership with AED, making sure that these meetings are a team effort. We're given ample time, that everybody has input on what our events are and what they're going to look like in that semester. And then kind of what we spoke of before, just having events that can fulfill different needs, from social events for camaraderie and showing that students are reasonable people, to more AMCAS workshop mock interviews from a professional standpoint. So those are that's one of the main things I've seen. Simone can probably add more.
I completely agree with what you're saying, Ryan. I think one of the strongest things about VITP as a whole is how collaborative it is. I don't think that it would be as beneficial as it is without collaboration between medical students and pre-health students. I think that if it was just one or the other organizing everything as a single entity, trying to do it themselves and then bringing in other parties, I think that something would end up lacking. There would be less of a gap that's bridged. I think it would be more general things like Ryan has come up with ideas in our meetings that I haven't necessarily come up with because he has a different perspective from me since he's already been through the entire process. I'm, along with other pre-health students, not really knowing what to expect yet. We're still learning the process ourselves, and we've heard from advisors and various other people about what we should be doing. But it's a lot more comforting to hear it from somebody like Ryan or other medical students involved in VITP. And then other events like our mock interviews have just received fantastic support because our members in AED don't really know where to turn to get that type of guidance. And it's just been a very rewarding opportunity for everybody. I think our biggest success is just that we've been able to get so much support behind this program and that everybody, I think, has seen its value.
Steve, if I can chime in, I think I'm sitting here and I'm taken aback by listening to Ryan, listening to Simone. And my initial concern about the VITP program, and I spoke to the leadership at that time about 3-4 years ago. Jerome Pettis has already been mentioned, but there were many others. But my biggest concern was sustainability of the organization. It is one thing to get a program started, and yes, I played a role in getting that process started. I was also president of the Columbia Medical Society at the exact same time. And the Columbia Medical Society played an integral role in facilitating and validating the concept as well as moral support, if you will. But the sustainability question continued to nag me and worry me regarding the program. Would it be a firecracker that it would just go off? It looked great for a while, a few seconds or minutes, months, or even a year, and then it would dissipate. And what I mentioned to the leadership at the time was that this must be a learner, a trainee-led program. It cannot be dependent on a faculty member, a physician, no matter how senior. Although, of course, that role was integral. And listening to Ryan and Simone, my job has been very, very easy. This is the second iteration now of the program, and I no longer go to bed worrying about sustainability. Not with young people like you're hearing from today. And again, Ryan and Simone are representing the group today as the senior leadership of our trainees, but we have tremendous, if you will, mentorship coming up, and others at both the undergraduate and the graduate level that are already playing significant roles. And I am confident now more than ever.
I agree with you. This discussion has been very uplifting, and it's remarkable the role that Ryan and Simone are playing in the adaptation to the profession of medicine and other healthcare professions is really quite amazing here. I think your answer leads a little bit into whether this is scalable to other organizations or not. So, for example, can other undergraduate colleges, universities, medical schools, pre-health organizations adopt this model in some fashion?
But Steve, I'm going to turn that one over to Ryan and Simone because obviously I'm prejudiced. I think the answer is yes. However, Ryan has now been involved and been discussing with Jennifer and SMA leadership regarding more details of the program. And one of the pillars of the SMA is engaging our youth and developing a youth strategy. And I think that the VITP program can play a major role in that strategy, but more importantly, using other organizations. And we can discuss that a little bit more further in the last few minutes of our podcast. But I would like to Ryan and Simone to comment about that, because I think it's a resounding yes. But who am I? I'm just this former dean. That's many years from my undergraduate and my medical school days. Ryan?
Yes, sir. I completely think it's scalable, and I think that it can serve as a model for other schools moving forward. And I think SMA might be might be the perfect source to serve as that bridge, because SMA brings medical students from across the Southeast, across the country, but mainly across the Southeast. And so these students can learn about the organization. We could put a system in place where we could draw out kind of how we did it, how they could enact it in their own school, and then use SMA as the link between all of them. And I think especially if you build that network for pre-health advising, that's where my heart is, and that's what I would be looking for. But the avenue of medical student to resident could be another very strong one that would really come into play where I'm at time wise, in terms of the only really when you're learning about these other programs and learning about their residents, it's just during interview day. And especially in the virtual environment where that's not the case, if you had a network where third and fourth year med students could be reaching out to residents at these different programs, getting advising, learning what their situation is like, it could make the decision about where to go easier, and it could open up programs that they may not have considered. So I think it's definitely scalable, and I think SMA could serve as that center link.
I completely agree with everything that Ryan and Dr. DiPette have said. As a pre-health student myself, I know that VITP has done nothing but enhance my college experience overall. I definitely think that the SMA would be a key link to spreading the knowledge that we have to be able to help the formation of programs in the future. I don't even think that this needs to be limited to medical students necessarily. I think people can take inspiration from this program and kind of turn it into anything that they want. Um, I know that I wouldn't be, and I feel like Ryan would agree with me, that we wouldn't be where we are today without the people who have mentored us in the past. And mentorship is something that I've always been very passionate about. It's one of my favorite things to discuss during AED recruitment, which happens every semester. So people get to hear about me talking about VITP pretty frequently. And it's received so much positive feedback. I've never heard anything negative. And I know that it's one of the biggest draws for people when they are applying to AED, and people have actually discussed it in their applications that I've read. So I think that emulating it at other schools would do nothing but enhance interest in pre-health fields, give people further support that they need, and really make sure that instead of just, yes, these are your deadlines for your AMCAS when you take your MCAT and all of that, it gives that more human aspect aside from the numbers game.
I think one of the other interesting questions for all of you is, how can Southern Medical Association and other similar organizations help with this process?
Ryan, do you want to go ahead and talk a little bit about that? Again, I'm turning to you and Simone, because as a past president, I'm pretty prejudiced and I'm pretty biased. I believe that SMA can play a major role. And again, it's not only SMA. We've had discussions with the AMA as well. Obviously, I mentioned the Columbia Medical Society. Dr. So I believe that those are avenues that I'm aware of. But I'd like to hear from Ryan and Simone regarding what their thoughts are on how organizations like SMA, and not just solely SMA, how we can help now you, the trainees, and the future trainees that are going to become leaders of the ITP well into the future. And again, that gets at that sustainability issue that I initially grappled with, and now I am much more soothed regarding the future.
Yes, sir. So, myself and Buckley McCall, he is the president of VITP this year. He's an M2, and Simone knows him well. They've been coordinating together. We attended a virtual monthly meeting with the SMA group where we talked about the organization, kind of what we had done, and we learned about what SMA had to offer. I think their PIT program matches extremely well with what they're doing. It's a trainee-led program, and I think the opportunities there, at least from a medical student perspective, are terrific. They are trying to start different kind of pathways within that organization regarding kind of social media presence, events like they're going to have a conference that's primarily medical student and resident run, for poster presentations, things like that. So knowing having that access to kind of a larger organization with more structure in place is wonderful, and it offers events that we probably couldn't just organize alone, being busy medical students at USC, but with a national organization structure in place, it offers those opportunities. And Buckley is extremely interested in SMA, and he is kind of going to carry that torch for me in terms of being our liaison there and interacting with that organization to bridge that gap and see how SMA can benefit not only VITP but medical students and residents in the area.
So I have been very fortunate to be AED's VITP director, not only this year, but last year as well. I'm not super informed on SMA. I do know things, but probably just because I'm a pre-health student, I'm not quite at that level of in professional school yet. But from what I have seen from a scheduling events perspective, trying to get the word out about VITP and things of that nature, I think organizations like SMA, not only for our chapter, our division of VITP, could they be helpful? I think that it would be extremely helpful to have organizations like that bridge the gap between us and maybe other universities that want to develop similar programs. As students, we might not have the resources necessary to do that. I know that I certainly don't have the ear of maybe other organizations at other universities. And while USC is a very large school, I'm one fish in a big pond. Um, so I think that it would be necessary to have organizations like SMA be able to spread the word about VITP to other organizations and other universities so that the gaps in mentorship there can also be addressed.
Thank you. That was all very useful information. One last question that I have is, how has COVID-19 been an experiment of nature, so to speak, affected your program at this point? And we'll start with Ryan and go to Simone and Dr. DiPette as well.
So it actually may be a slightly better question for Simone because her and Buckley have been kind of organizing and working together this year. So I'll kind of let her start first, and then I can see if I can add anything.
So COVID-19, no surprise to anyone, has made everything a little bit more difficult in all aspects of life. It's a little bit of a double-edged sword because on the one hand, we would all really prefer to have things in person. It's a lot easier to facilitate personal relationships if I'm talking to someone face to face than if I'm staring at a computer screen, right? I think we would all agree with that. On the other hand, it does make everything a little bit more accessible because some undergrad students, for example, they might not have cars or they might have really tight class schedules that may inhibit them from being able to make it to an in-person event on time and things of that nature. So when we've been planning events, yes, we've had good turnout because things are online and people can do it from their homes. But it's not quite the same, and I don't think that it will be quite the same until after COVID. We've done our best to continue to facilitate relationships between medical and pre-medical students. We did mock interviews. We used the breakout rooms on Zoom. Those were a huge help. We've all been trying to adapt to the technology aspect of the 21st century. And even though I am, a 22-year-old college student, I'm pretty good with a computer or a cell phone. I do not know all of the inner workings of Zoom. So it's been a learning curve, definitely. It's something that I think that we're going to have to continue adjusting to for at least the rest of this school year. I wish, and we're still trying to figure out a way, Buckley and I are trying to figure out how to do more hands-on events like our clinical skills workshop. That was really, really well received. Everybody loved it. I don't know a single person who did not have a blast. I know I had a blast. But things like that, where we're trying to keep socially distanced, are difficult to do. I can't really go up to Ryan and be like, hi, I'm going to take your blood pressure now, because I'm trying not to touch him. So we're trying to figure out what can be transitioned to online. We're lucky that a lot of our events like mock interviews and various workshops can be transitioned to online. But it's always better to be able to have things in person for that human connection. But I think that we've done well so far. I definitely think that it will continue to be a learning curve.
Steve, again, this is Don. I see it from a different angle, probably because of my position and my age. I see COVID-19 actually as a stress test for all of our organizations, from all disciplines, et cetera, including VITP. And what I've taken away from it is that I'm astounded at the flexibility, the adaptability, the workarounds, if you will, that the trainees have done at all levels to continue the program, continue to grow the program, continue to get the word out regarding the program under the most extraordinarily difficult circumstances. Nobody could have ever imagined last year what we've all gone through this year, including our students with distance learning and virtual classrooms, et cetera. It's been extraordinary. I do think that there's one area that has suffered, and that area was difficult to begin with, even under the best of times, and that was to engage our house staff, engage our residents, because they are extraordinarily busy. We've talked about some of the successes. We can also talk about some of the challenges. And one of the challenges of the VITP program was the concept was to link all three trainee levels. And we have done that to an extent, but not to the extent, I don't believe, that Ryan or Simone and the other leadership of VITP would like to see. But COVID-19 has really put the brakes on that this year. And that is because of the multitasking that our house staff are meant to do, the extraordinary stresses of the hospital systems, et cetera. So I think that's just a heartfelt admission, if you will. And I think that that's something that we can hopefully work on to a greater extent. And hopefully the pandemic will be behind us someday.
I'm going to let everybody have one more opportunity to make any final thoughts or comments, and we'll begin with Ryan.
Yes, sir. So what Dr. DiPette said earlier really hit home for me, in that I think one of the core components of VITP is that it's trainee run, and that the students that are in leadership are all very passionate about mentorship. They're passionate about helping students get to the point that they are. And I think that is kind of the essential component to building a sustainable mentorship program, is involving students that are passionate for it, to continue to grow and to continually hand down that process. So I just wanted to reiterate that, and thank you guys for having this structure in place to have us spread knowledge about the IPP, and hopefully serve as a model for other organizations and schools in the Southeast.
Yes, I would first off love to thank you all for the opportunity to share what we've been able to build with VITP. I think is something that can be emulated and very effective at other institutions, along with the difficulties of transitioning to virtual formats with COVID. I think another thing that COVID has done has definitely made it a more high stress environment, like what Dr. DiPette has said. And I know when I'm talking to other pre-health students, people are in a little bit of a panic because it was difficult to find opportunities like shadowing before. And now that is just times 1,000. And now more than ever, students need that type of support from people who have already gone through it. And I think that that's the most important thing that VITP has been able to provide, especially now.
Dr. DiPette, did you want to have a final thought?
I think what you've heard from Ryan and Simone speaks for itself. The trainees are passionate, they're excited, they have made remarkable contributions. Steve, you mentioned the SMJ paper in December's issue. This is the second paper. The SMJ was gracious enough to validate the initial paper describing the formation, conception, etc. of the VITP. And now we see the progress that's been made in the next the 3 years or so. I am extraordinarily optimistic. But what I would like to challenge VITP and SMA and other organizations is help us spread the word like we are today, like we are by publishing the program in journals such as SMJ, and really to scale up the program to other institutions, help us even grow our own program within our institution. And I'm encouraged. I also want to thank you. Steve, thank you. I thank the editorial board. And also, I thank the reviewers that reviewed both our papers and found it of value for the SMJ readership and of high enough quality to be published in such an outstanding journal. Jennifer, you've been relentless in continuing to help us and support the program. And Dylan, of course, for all of the AV and connectivity. Again, we wouldn't be able to do this without the SMA and the SMA leadership. I look forward as a past president and hopefully still a member that can play a role in SMA to the youth committees that are forming, the insertion of the youth and our trainees into our leadership and having a seat even at the executive committee level, et cetera. And again, I'm extremely encouraged and I cannot wait to see the next 3 years.
I want to thank all of our guests on this podcast for participating and sharing their enthusiasm and their insights for this issue. I think part of the professional credos of medicine and most other health care professions involves a commitment to growing the profession and to supporting members of the profession, including those who are at their beginning stages, as we've discussed here, thrive and be successful in their professional careers. I think mentoring is well established in medicine for people that have finished medical school and are in residency and in their clinical years. And perhaps more emphasis on mentoring, as you are indicating here, is an important element in making further progress in all of this. Thank you all for participating. This concludes this podcast.
Thank you again for joining us. To subscribe to additional SMA podcasts, please visit sma.org/podcasts. Thank you for listening, and stay tuned for more Physicians in Training podcasts. To view all of SMA's podcasts, visit sma.org/podcasts.